Good morning. Welcome to our first School Health Advisory Council Town Hall. We've done a lot of topic-specific webinars for School Health Advisory Councils over the years, but this is our first attempt at a town hall. I hope that we're successful. We may have a few glitches, but we hope that it's going to be something that everyone will gain from. We've brought together several of our most experienced School Health Advisory Council leaders to answer your questions. And we have shared out a one-pager that this group helped develop to help guide your SHACs at the end of school and through the summer and into the fall. We will resend that out with the recording from this webinar. Today's SHAC team is Stephanie Kellum. Come and wave, Stephanie. And she's with Fort Bend ISD. Alice Kirk, who is with AgriLife Extension. Mario Reina with McAllen ISD. Pete Silvius with Seguin ISD. And Joycelyn Gerard with It's Time Texas. And I'm Michelle Smith. I'm the state coordinator for Action for Healthy Kids and a 20-year veteran of the Austin ISD School Health Advisory Council. So if you have questions, just the logistics, you can enter them in the chat box, and we will answer them after we answer the questions that we received from yesterday. Also, if you want to clarify anything, if someone's sharing information and you feel like you need a little bit more, you can raise your hand. There is a hand raising option if you click on participants, and raise your hand and we'll unmute you and you can ask your clarifying question. Any questions we don't get to as part of the live event we're having today, we will answer via email. So we'll include that information along with resources and a copy of this recording as well. We are going to probably send out a brief survey to find out what you thought of today's event and if this is helpful and if it's something you want to see us do in the future, or if there are other topics that you'd like to have discussed with different SHACs. We are recording this event, as I mentioned, so we'll share that with you. So without further ado, I would like to start off with some of the questions that we had sent in yesterday via the survey. The first question is, with the ongoing uncertainty, how do we know what's allowed and what's not, and are there any guidelines out there to follow as we're moving forward in planning events? So what is available right now is primarily from the Center for Disease Control. They have produced a chart which kind of outlines exactly what steps you should take and what you need to do to move from one step to the next to help schools reopen. We also are going to send you an administrator report, which is something that is more process and provides guidance on reopening for administrators. And then we're waiting for information from TEA and ASCD and some of the other national organizations as things move forward. We will also share, Action for Healthy Kids has a webpage that has quite a few national links on different things. And then we have some specific things we'll send you. One of them is on recess that was done by Peaceful Playgrounds, which gives some guidance on how to have recess successfully. So I hope that answers that question. And like I said, there continues to be more every day, but there's still a lot of unsurety about what should be happening. Okay, so does anybody have anything they think they need to want to add on that, or any resources? But we'll probably share those electronically with you. So the next question was about getting communities involved. What are innovative ways you have partnered with community organizations during this time? So Ray, I'm going to ask you if you want to talk about that first. Let's see, Ray, do I have you unmuted?
There we go. I think I'm unmuted now. Yeah, so what we're seeing, thanks for inviting me to help speak on this subject. So what we're seeing in our communities is it's slowly opening up. A lot of different places have different, they'll have different protocols. And so the best thing to do is to go out and touch base with any of the, currently what I'm doing is touching base with collaborative leaderships to find out, what exactly are they doing, how comfortable are people with, seems like people are more comfortable doing the virtual sessions of getting together more than they are in the live sessions. I do know that even some of our community organizations like the local Chamber of Commerce here in Georgetown is doing a limited seating event. And so I would say that's probably how most of the community things are opening up. There's a lot of people that are also looking to organize funding around certain COVID things. So there are some grants that the community people are looking at as well. So best thing to do is go back and touch base with everyone and find out what is their specific things that their organizations allow you to do.
Okay. Joycelyn, would you like to share?
Yeah, I'm Joycelyn Dorado with It's Time Texas, and we ourselves are in many ways partner with schools and school districts in order to support school districts' vision for health and wellness in their schools, in their school communities. And so I've spent a lot of time really listening to understand what is possible and how school districts are responding in this time, and really having that inform how It's Time Texas responds. But in that time, I've heard a lot of stories and the ways that innovative ways school districts have partnered with community organizations is first as they've partnered with local food banks to be a site for distribution. Other districts have partnered with out-of-school time providers to do programming virtually for their students, including like direct facilitation. An out-of-school time provider might come in or be available to do like a 30-minute session with kids on a variety of topics, whether that's health or nutrition. It's Time Texas has partnered directly with districts to look at their employee wellness strategic planning or employee wellness programming to think about how they can support having staff be well and healthy to create, communities, even virtual communities where the adults are helping students also think about health and wellness in the classroom. Some school districts have partnered with their local health collaborative. So your community could have like a mayor's fitness council or a local health coalition focused on the same things as your school. One particular school district is partnering with their local health coalition to do some strategic planning with them to get ready for the fall. And the Health Coalition is providing some community research, some community data in order to inform that. And so a way to get started might be, if you're looking to partner with community organizations to respond in this time, there might be partners in your out-of-school time community or partners across your district that are really, like Ray said, waiting to hear what you need and what your priorities are. And so to reach out to them and be honest with what you're facing and see if they can help you respond in the ways that are relevant for your community.
Thanks. Alice, do you want to add anything?
Yeah, just real quickly, to really tack on to the point that Joycelyn was just sharing, our Texas A&M AgriLife Extension agents that are incredibly strong grassroots on the ground partners are throughout the state in all counties, and many of them have assisted throughout this the last several months in everything from supporting food pantry drives to helping school districts serve as sites for food pantry. Some sites, school sites, have partnered in some of our South Texas counties to help serve as places where actual COVID testing was being done in the parking lots of large school districts. Our county agents are wonderful resources and partners, and so I do encourage sites and school districts that are on to look to their local county extension agent to be partners in helping identify and support programming needs.
Awesome. Thanks. Welcome everybody that's joined us. I'm excited to see people in chat announcing who they are and where they're from. It's always nice to know. Our next question, how do we get parents to join school health advisory councils? This is one we have battled for the whole 20 years that I've been involved. So I'm going to let Stephanie talk a little bit first on this one.
Sure. Thank you guys so much for having me. And I love this question because parents have such a strong voice in the school districts. And so the SHAC is actually a natural platform for parents to engage with. I think it's just educating the community about what the SHAC really is and how it supports the school district. And, you know, making one-pagers to educate those parents, having those in the vestibules of the schools is really helpful. Some other ways to engage parents are, you know, partnering with the PTOs, PTAs. If you're in Title I schools, potentially you have a parent educator or a parent liaison, and leveraging them as well to encourage them to spread the word among the parent community. That's always helpful. And then, you know, encouraging your current members to, you know, bring a friend to a meeting. Hey, check this out. Sometimes we find that the parents who have a lot of complaints potentially, or, you know, have a strong voice, they're a good advocate for SHAC as well. So if you have a parent who really is passionate about something, ask them to join your SHAC meeting and have them share that passion with the SHAC and potentially leverage that energy that they have to advocate for the school district.
Pete, what is your secret for getting parents?
Yeah, thanks, Michelle. I think Stephanie really answered that quite well, and so I want to emphasize all of those points that Stephanie just made. I want to add a little bit about how important it is, and Stephanie touched on this, and Michelle, you did too, that this is a parent organization. So the voice of the parents by design should be heard through the SHAC. Now, that's always a little bit of a tightrope act, because how do you empower, but then also manage and support? Because ultimately, at the end of the day, we want the SHAC to provide a template, a direct access to the school board to really harness changes. But we also have to stay focused enough to be able to make those changes fit into the school system that we know often can be tough to navigate. So that's an ongoing challenge for us, is to figure out, you know, what are the tasks that we want to take on. We need parents to be passionate and frustrated and challenge the school systems that they feel are not supporting the needs of our community. But at the same time, we need to make sure that those concerns are heard in a productive manner. You know, we can often get off the rails and are no longer working towards positive outcomes, but are working towards dismantling systems, and that's not what the intention of the SHAC is.
Okay, Mario, do you have anything you want to add on that?
Yes, first of all, hello to everyone. Welcome. I just want to say that one of the things, I've been involved with the SHAC for a long time, and at the beginning it appeared that school districts were dominating, school district employees were dominating the SHAC membership, and realized we were not getting anything, or we weren't accomplishing as much as we wanted to. So you got to have a lot of different strategies. And one thing, like for myself, that I'm the one that does a lot of the recruiting. And right now I was looking at our membership, just to let you know, we have 25, and out of the 25, 18 are parents. So that tells you that we do have the parent culture established. So that's what it's all about, having that culture. So examples of recruiting, when I ask the school board members that I need additions to my SHAC, I don't even tell them that I need, I just tell them I need a parent. And that, because it's a lot harder to get parents than it is to get community for me. So that's what I've done in the past. And it's about how you recruit and always keeping in mind. Now, once you have them, it's not only about sugarcoating your agenda and just making it And I've seen that because I've gone to other districts where I've seen their presentations. And it seems to me that if you're going to have an agenda that is geared towards the district making the decisions, you're not going to go anywhere. So once you get your parents, you got to make them feel like they are part, that they are a voice, and that you're listening to them. And strategically, what I've done when we have something to go forward to the board, I always make sure that it's a parent that brings it forward. And never forget that your co-chair is required to be a parent. So that's my take on this question.
Thanks, Mario. Okay, let's move on to this question. I would love to get ideas from you on ways to spark engagement among members at SHAC meetings and outside of SHAC meetings. So I'm going to call on you, my three panelists again. Pete, you want to tackle this first?
Yeah, sure. Thanks. So again, I mean, this question really lends itself to how do you get parents involved? Well, parents need to feel like their time is spent in a productive manner. So I think it all relates back to what is the work at hand of the SHAC. And so let me give you some examples. So we have had some passion projects of the SHAC that have given parents access to really seeing some changes through. One example that I think we're all really proud of a few years ago was we passed a recess policy at the district level that this is not just in district regulation, but this is in board policy that all students will have 2 recess periods a day in Seguin ISD, and that recess will not ever be withheld for punishment. So it took a lot of work on the part of the SHAC to push to make that a board recognized policy. And so in that work, there's so much opportunity for parents to feel like, hey, my time is well spent at this meeting. No one wants to show up to a meeting where they feel like they're rubber stamping objectives that are put out by school administration. And so that, that can make your work feel kind of monotonous and really not as valuable. So it's all about those passion projects. We've had the same thing happen with some things related to school nutrition, trying to really enhance the opportunities that we have as a school district with school nutrition. And so many of the families that are involved with our SHAC now got involved with an initiative to work on some salad bars years ago, and we've been able to maintain them through that.
Stephanie.
So yes, absolutely. I agree with Pete completely. And I think too, on a more granular level, like in the meeting specifically, I think for Pete's example, there's an overall goal that the SHAC has set, but we're working to set engagement in the meeting so that parents feel engaged in that conversation, that discussion. So some strategies that may not be possible in the fall, but when we were able to gather in person, we would do gallery walks where people would have questions on the wall and they would answer questions about why it's important for them to have a healthy student. What is their vision for the health in the district, or what is their hope to become a member? Why are they here? What can they add to the committee? And really tried to leverage the strengths of the individuals that were part of that SHAC as well, because it's amazing the diversity that's within that group that you could leverage the resources. I think assigning kind of job roles to individuals too, so having someone help with communication, having somebody do small job roles throughout the SHAC will really help advertise your SHAC, but also give a parent something that they can latch onto so they do feel engaged and they are feeling like they're part of the discussion. And at those meetings, they feel like they can walk away and say, I can send this message, or I'm contributing this way. And doing that, I think though, it also is important to set goals for the SHAC so that there is something that you're working towards, as Pete had mentioned.
Perfect. Yeah, I think it's really important that you have very defined communication channels, because I've had members of SHAC now that I'm no longer on Austin SHAC reach out to me and say, I don't feel like I'm valued, I don't feel engaged. And it's because the communication channels have broken down. So it's really important to make sure that everybody understands who to talk to and how to get in touch with whether the chair or another member of the SHAC. And if they don't feel engaged, they won't stay. So this is a really critical thing. Mario?
Michelle?
Yes.
Oh, sorry. Michelle, I was going to also add that several school districts, especially in some of our rural counties across the state, we find that they employ and really kind of utilize a buddy system between some of the SHAC, what is leadership, and maybe some of the key school personnel, and a parent. And so where you do have limited number of parents who are engaging, and they certainly want to have a voice, it can be helpful to buddy one-on-one with a school nurse, or in some of our SHACs, we've heard that they will assign 1 or 2 parents that are working very closely with the PE teacher. There's a buddy system, and as a collective group, then there's one of those 3 people that is always available to help present at SHAC meetings or board meetings. So the buddy system works well.
Did you have anything to add on that, Mario?
Michelle, the only thing, the points are already well stated. The only thing I wanted to add, because I'm reflecting on this question, is that 2 words, vocal and influential. And that's what has helped me in getting things done through our SHAC. Parents that were vocal, sometimes we're afraid of them, but if they're influential, it helps you. And as I reflect, I think we were one of the first school districts many years ago that first implemented the mandatory 20 minutes of recess, but not only 20 minutes of recess, it was, what do you call it, the recess before lunch, which is not very easy to implement, but it was vocal, influential parents that impacted that decision, that influenced the school board to say yes. It was not in-house school district employees. So I wanted to share that with everyone.
Thanks. All right. So this kind of segues right into the next question, which talks about subcommittees. How are your SHACs structured? What type of subcommittees do you have? And how do they function? Do they meet regularly? What is their role? Mario, you want to start us off on how your SHAC works with subcommittees?
Sure, thank you. Yes, one of the things we noticed is when you have your regular SHAC meeting, sometimes you don't have enough time at the regular SHAC meeting. So that's one of the reasons we established some subcommittees. And we have 4 in McAllen, which is emotional, social, food and nutrition, human growth and development, and physical activity and fitness. But we established those to get them busy, and they meet as needed. But that also gets some of the parents that might not want to be as involved at the regular SHAC meeting. It gets them more involved, and they have more dialogue in those. And that's how, and then they come back and they'll report to the SHAC meeting. So we get a lot more done, and that's one of the strategies that we use to bring in some subcommittees and get more work done. Because sometimes 1 hour, we try to meet about an hour because we meet at lunchtime, and depending on the year and on the conversations we're having, the subcommittees can be an excellent way to get others more involved.
Stephanie, do y'all use subcommittees with your SHAC?
Yeah, so subcommittees are really a great way to engage parents, especially parents who maybe don't feel like they can commit to the full SHAC. So oftentimes we have parents who don't come to the regular SHAC meetings, but come to our subcommittee meetings because they may be very passionate about certain subjects, and to kind of go to what those subcommittees look like. It may depend on the year in terms of where we feel like we need to focus our efforts, but some examples can include health, PE, physical activity as a subcommittee. Nutrition is always a very popular subcommittee. Mental health, SEL is another popular subcommittee. And then family and community engagement is an area as well. But again, it's really dependent on where you're looking that year for your SHAC to go, and kind of what people are passionate about, and then allowing those subcommittees to function almost on their own and have them set goals as well for themselves, because oftentimes we find that some subcommittees may show up and they look and they say, we're not sure what we're supposed to be doing, and then they tend to fall apart from there. So really having those subcommittees determine what their goal is and making sure it relates back to the overall SHAC goal is very important. And then I guess the other thing I wanted to add too was, you know, sometimes people are trying to figure out when do we put those subcommittee meetings in. So I've seen districts where they put them in right at the end of the general SHAC meeting, or maybe the group meets before, or they meet in between those regularly scheduled SHAC meetings. And the great thing about meeting in between is those parents, again, feel engaged, because the longer they're away from having a SHAC meeting, the more disconnected they may feel. So the more often they have time to meet and discuss and really feel connected with the conversation, I think is helpful, because it helps maintain that consistency on what you're focusing on.
I wanted to add to Michelle a question that we have received here on chat related to, you know, are there specific designated subcommittees for a SHAC? And my response to that would be that it is very dependent on the focus of the SHAC agency or the SHAC group, what some of their goals are, where some subcommittees may be formed specifically to target a particular area. Mario has identified his subcommittees that they have at McAllen ISD. He identified emotional and social, food and nutrition, human growth and development, and physical activity and fitness. And in my experience, those have varied. Subcommittees are varied across the state. Is there anyone else on that would like to share their specific subcommittees?
Real quickly, there is state law does mandate that you have a physical activity subcommittee. So that is one that you have to have. And it is supposed to review how to get kids more active during the school day. That could be recess, that could be how they're active in PE class, it could be brain breaks before and after school. But the SHAC should be looking at and have a subcommittee that addresses physical activity. Just real quickly, in Austin, we tried to have subcommittees for all 8 components. They weren't always active all at the same time, but we tried to have chairs and make sure that we were looking at all the different areas. Anybody else? Okay, thanks guys. So this is a good question. How large a role should SHACs have in selecting programs like sex education, providing mental health resources, and nutrition guidance? I'm gonna let Ray, who's one of our veteran SHAC members, even though he's not SHAC currently, talk about that because he's had that experience.
Yeah, I appreciate that. I did cross over to the other side as a community person now, working at a behavioral health hospital, and then doing some consultant work as well. But let me just say, kind of the way we worked on this, so for our human growth and development, all of our sex ed curriculum, we pulled that together as more like a task force, and it would come up as we were doing curriculum adoption and curriculum review, and then we'd have ongoing updates to our total SHAC. I think when you get involved with, let me just talk about mental health. It's a great way to start bringing providers in and including them into your SHAC. One of the things that we always had a close alliance with was any of our local clinicians within our communities that were willing to join us. We always had the county health district as a representative within the SHAC as well. So kind of think of it, sometimes we think of it as a human topic, or we think of it as a health topic, but sometimes you can go into it as a human topic and think about, so what are the human groups that we're trying to work with, and what are those needs of those groups, and then who could we bring in that could represent those groups in our communities. So it gives you a great place to interface with those different groups, especially if you run into them at health fairs or they want to come in and do some sponsorship with your school district. So I'll give you an example. One of the things, all the community health organizations in our school district held a employee wellness fair for our employees when we did all district-wide staff development. And that was an awesome way to reciprocate kind of what we were asking them to come in and work with us as providers towards our SHAC, and then they could offer something on the backside that was health and wellness for our employees. So yeah, I'm sure Joycelyn probably has some ideas as well. I know It's Time works a lot with those groups, so I'll
I always forget to unmute. My comment on this is the SHAC should be, it's part of the state law that you should be reviewing all sex ed health curriculum and making recommendations to the board. So that is part of your designated job. Also, mental health was something that was added in one of the recent legislative sessions, that the SHAC should be reviewing mental health resources. So that again is something that is your opportunity to have parent engagement and do the research and then make what your parents feel is a positive recommendation. Nutrition guidelines, that's going to depend on how your SHAC, how you want to go. Our SHAC looked at vending back in the earlier years and made a policy around vending machines. We've also have been very engaged with our child nutrition department and gave recommendations to them on things that we felt were, critical issues for parents. So I think it's going to depend on what is most important and what the priorities are in your community. If you've got a really strong nutrition department, you may not just have to spend a lot of time policing them or looking at what they're doing. But if you don't have recess, that may be where you focus your energy. If you don't feel the district has strong mental health services, then that is where you may want to focus your energy. But the SHAC can play as large a role as is necessary to make sure that good programs are put in place at the district. So did you want to add anything, Joycelyn?
Yeah, when I think about this question, a part of me also thinks like there are some pieces that are difficult and challenging and feel political that a SHAC can or cannot take on. And I understand that. I'm empathetic towards that. But I come back to the idea that like SHAC is representative of the community. It's not that the SHAC itself has to have the answer. How is the SHAC, if it's challenging, creating more space at the table to amplify the dialogue and amplify the the conversation around these issues? And so I think that while it's it's a challenging topic, I think the SHAC also has a place to gather voices and show the district where the school community is on this, and create a dialogue of how do we make decisions together, instead, not just feel the stress of like, we have to make this decision and it's all on us. No, it's also on the greater community. And how are you creating those channels? How are you creating those opportunities, whether it's through a buddy, whether through it's amplifying it on your, on your social media around this discussion of what are we facing? And those decisions are important. And so like pull people into the decision-making with the SHAC. That's the SHAC's opportunity as well.
Thank you. Anybody else? Okay. This person would like to know more about social emotional learning during a time like this particularly, and what type of options are there for SHAC to work on this. Pete, you want to talk about this?
Sure, and thanks for that question. I I think that that is a pressing question, and I think that it's something that all of us need to recognize as being possibly the most important or primary responsibility of all of our systems these days. The response to COVID is significant. The response to calls for social justice is significant, and so we would be negligent in our efforts, I think, as representatives of school district, as representatives of the community in the SHAC, if we did not recognize the awesome responsibility that we have to be thinking about social emotional learning. So what does that look like? Well, first, I think that we need to be very careful about thinking about social emotional learning as being a canned curriculum or some
Right.
siloed type of a approach. Social emotional learning has everything to do with every interaction that every adult and every student has when they are confronted with each other. So how do we tackle this? Well, we need to start having the conversation about what are those foundational needs that all of us come to every meeting with, come to every facility with, and try to address those things. Social emotional learning is recognizing that if the systems are not supporting me in the school, systems such as if I don't have access to a healthy, nutritious meal, if I don't have access to clean restroom facilities, if I don't have access to a sense of safety and security within a facility and within a group of people, then I can't learn. When students are coming in to a school, if they are spending any brain power at all acknowledging that they do not feel comfortable, that puts a limit on their ability to focus on the education at hand. All of those things we know have existed forever. I think that what COVID and with these recent developments that have really highlighted the extreme racial divide that we are all responsible for working on, is the equity issues. Our most at-risk population is the most vulnerable and the most affected by all of these areas. And so the only work that really matters right now, the only thing that any of us should be even focused on, is how do we support one another going forward. And so so I think that is the only work that's necessary for the SHAC for the foreseeable future.
Thanks, Pete. Joycelyn, did you have something on this that you wanted to share?
Yeah, I think what I've seen in my own practice and what has been echoed as others have shared stories of their practice is the need for a safe space to talk very honestly about their practice of working with kids, about how they feel as a person at this time. We've done a lot of work around educator self-care, but I think that flows into just how are you taking care of yourself? And I think about, convening a group of people, whether it's virtually or, safely physically, there will be a need to honor the space that we're in so that people can be honest about what they need and those needs can be honestly met. And by honestly met, the group may not have the skill or the resource to do it. So then can you honestly say, we need help? And whether it's the mental health authority, whether it's a local food bank, whether it's an architecture firm looking at your space, to really say we need this type of help because we cannot do it. And to know your lane in what you can do and to know the goal of what needs to be done. And I think about you know, just bringing people together, and how you have to name those things in these times, because it's so fast paced, and it deals with people's, you know, emotions about who they are and what they have the capacity to do. And I think the other thing I think about is kind of what you know, echoing everything Pete says and says so eloquently. But we're gonna make mistakes, and how do we recognize them and correct them? And I was on this webinar last week, and they were talking about physical space and how children will be spaced, and like how young children, and I have them myself, want to hug people and want to touch people. And so like how you correct that behavior in these times, like it starts with just people and how they interact, and thinking about, you know, moving up those lines of like in the classroom, in a school community, and the power that a SHAC has, and the awesome responsibility and opportunity a SHAC has, again, to bring people together to talk about that, and create new norms around that. And so I'm kind of rambling, but I think it's important that when thinking about social emotional learning and what do we do now and what are our resources, I think a SHAC leader has to think about how they're entering that SHAC space, and how they're naming and re-norming what that SHAC space is, so that people can have honest conversations about what their school needs and what resources they truly have available in order to meet those needs.
Thank you. Those were very excellent answers. We will send some resources that may be helpful to you. We are getting quite a few questions. I will tell you, some of these questions may be better answered in writing, because they will be take a little bit of time to respond to, but my panelists are answering some of them as we go, but we can elaborate on some of these a little bit later. So the last question I have before we answer some of those questions is for everybody to talk about what their top priorities are for their SHACs between now and going into the fall. And we had somebody ask, with the COVID concerns, how has that changed things? And what are your SHACs going to do, or how your SHACs going to be involved? What are your thoughts? So Mario, I'm going to ask you to go first.
Okay, well, I am having a meeting on Thursday with my SHAC, and I am working on the agenda, and it's hard to prioritize, right? So I know I'm looking at my agenda, we will be talking about reopening strategies, you know, what their thought process is. Of course, our district has some standards already. And I do want to add, Michelle, like you said, there's a lot of resources, and Shape America is currently working with the CDC. They got a grant. So they're going to be working on reopening strategies, which is good for us in physical education, because ours are going to be as challenging as anybody else's, right? But we're talking about social and emotional development. Everybody's already talked about that. And we're not going to forget about EDI, equity, diversity, and inclusion, which is a really important buzzwords. And that's going to come out a lot with social and emotional development. And of course, we can never forget, because we know we have those problems, especially now with kids probably not exercising as often, and what kind of nutrition are they getting. But we will definitely look at the obesity area. So those are going to be probably a lot to cover, and that's what we're going to be talking about. And I know that probably the reopening of schools is going to be at the top of the list.
Stephanie, what are y'all focusing on?
Yeah, so I think it's funny because we were all wrapped around our wellness policy, the triennial assessment, and working on those things. And then we kind of were split in March and have been kind of trying to get back into the groove. So I think the things that we're going to be looking at is merging the two together, because I think we need to stay on track with what we have had discussions of, because as you look at the disease, health is at the priority, right? And that's why the SHAC exists. So continuing to be that platform for parents to ask questions about what this is going to look like, how can we have these discussions? I think SHAC provides a safe space for those questions as well. And I think you might be able to see a lot of parent engagement that way too, for those of you that are looking to add parents to your SHAC. This might be a fantastic opportunity. And as we mentioned earlier too, looking at subcommittees, you may want to create a COVID subcommittee as someone that's going to look at strategies, things like that, and maybe they focus in separate subcommittees as well. But, you know, working with your coordinator of health services or your director of health services is going to be important. Having them do, you know, regular updates. I think at the SHAC meeting too, parents are going to want to know, what does this look like in terms of, you know, statistics, and how are you handling it? So I do see, you know, reoccurring conversations around COVID, but I think it'll be important to stick to those overall arching, you know, goals and focus to make sure that we don't lose sight of the overall picture of, you know, a whole child is a healthy child. So.
Pete.
Yeah, I think, you know, I would love to be in Mario and Stephanie's SHACs. I think they both do a wonderful job. And so I think they're right on track, and I think we can all learn from that. I want to echo some of Joycelyn's comments about the importance of renorming as we go through this next, what becomes our new normal. You know, I really think this is going to be a long time. You know, this is going to reshape how we interact with each other. One of the things that I am most worried about is related to the reopening. And Joycelyn touched on this too, you know, is we know that student health is dependent on access to each other. It's dependent on access to the outdoors. It's dependent on free play. If we're not careful, we're going to forget how vital those aspects are to ensuring a sound immune system, to supporting the whole child, the social emotional side that we know has a direct tie to the physical health side. So how we navigate that, I think, is an unknown, you know, but I'm hopeful. I'm really happy to hear, Mario, and I look forward to hearing more about the collaboration between Shape America and the CDC. Because right now, when you look at CDC recommendations, you know, we still have recommendations that have playgrounds closed, you know, and I understand that. But I also, I believe that we're going to have to start thinking a little bit about what are those ramifications of that social isolation, and how is that going to ultimately play on the overall health and wellness of our community. So I want that to be something that we really navigate, make science-based decisions, but also recognize that we are going to have some fallout for many, many years that we need to be very intentional about.
Okay. Does anyone else, I mean, the rest of my panelists really don't have a SHAC that they're going back to this fall. I'm no longer on a SHAC. Alice, did you want to add anything about what your SHAC might be looking at? Or do you have a?
So interestingly enough, we also have our meeting scheduled this evening. And so it will be very interesting to see. I would echo what the other panelists have said. I do believe safety of our children, our teachers, faculty is obviously going to be first and foremost, but I think that there is a lot of work that will be intertwined in all of these areas as we look at what our new goals and how things may morph given the climate that we've all moved to because of the pandemic and just all that is happening in the world right now. So more to come. Yeah, we'll be sharing for sure.
So this was just a quick question. I know Alice has been monitoring questions and she's going to help us sort through a couple. We are running short on time, but just to kind of expand on this, have any of your district leadership decision makers asked your SHAC to be involved in reopening strategies? Anybody?
We have. We've shared our COVID response document with the SHAC, and it's still a work in progress. We're meeting as a task force now on reopening strategies, but all of those will be, I'm going to use the word vetted, by the SHAC, not to the point to where, some things just are going to be based on school systems that we understand at a higher level than the community. There's some real challenges with transportation. There's some real challenges with a lot of logistics, and funding. But we certainly will engage our community, and the SHAC is the best way to do that. The attendance is going to be a real concern going forward, and so we need the community to feel as though their concerns are being honored. No one wants to send their kiddos to school if they don't feel like that's a safe environment for them. And so our SHAC is a perfect conduit for that conversation.
Anybody else? That's a concern that I have, is that the SHACs are kind of left in the cold, and that's why we feel it's really important to have this town hall and send out the one-pager, is to encourage SHACs to reach out to your district and make sure they know you're there, and make sure that they do engage you in this process and get the voice of the community and the voice of the parents.
Michelle, I would just like to offer that SHACs maybe think internally how they can, what can they offer to the district that's going to be new and different as they're trying to reopen. So, for example, the SHAC might offer to become a sounding board for ideas, and have people also, they could be a facilitated community input group where you could actually brainstorm ideas and pull ideas all the way through. They could act as ambassadors. That's another role that the district could come in and say, we've worked this groundwork, we've done the sounding with our SHAC, and now what we could do is get some ambassadors to go out from the community, and especially if you have some of your current parent organizations on your SHAC, like your booster clubs, your PTA, your PTO, other kinds of organizations, and have them go out and be ambassadors for what you're trying to do and what you're trying to accomplish. I think that you can also just look at some strategic opportunities to bring kiddos in. So this could be an opportunity to Zoom them in, maybe not meet in person, but and then find out what is their thoughts on some of these ideas. So I think SHACs could maybe reimage themselves into something that the state, when they created the legislation for SHACs, never even really thought of. To Joycelyn's point, we really have to start thinking in a different way now. Maybe SHACs take on a different role.
Awesome. So we're running up against the end of time. Alice, do we have a question or two we can fit in?
Sorry, unmute myself. This was a question that is, I think, very applicable for the state of Texas as large as we are. Someone asked a question about geographical areas where sometimes maybe tech capabilities aren't present. And I think, Stephanie, was it you that responded? Would you like to respond some of your approach for that? Because I think that's applicable.
Sure. So Corbin ISD is a pretty broad geographical, sorry, I have a 3-year-old next to me. Corbin ISD is a pretty broad geographical platform. And so a strategy that you could consider is moving your standing meeting around the district. So not always hosting it in one location, but trying to spread out so that you can accommodate those individuals in the different areas. We've done that actually with our subcommittee meetings where we've met on campuses. That way we were able to leverage employees, because we have school nurses that really want to engage in the subcommittees, but they can't get away from their campus. And so we actually go to the campus themselves, and they're able to step away from their clinic for however long they need for that meeting. So potentially circulating around the district for your meeting location.
Great. Pete, this is a question for you, I think. So one of the questions here has to do with what happens if a school district says that they can't afford a program that there's a lot of parental interest in implementing? What strategies have been used to either secure funds or ensure that that program can still be implemented?
Yeah, I thanks, Alice. I saw that question, and hi, Karen. Long time no see. So yeah, that's a good question, because I'm not aware of any SHAC that has a budget. So none of them do, right? But there's money out there. So I think that the answer that was provided about grants, I think, is a really important thing. I think that that's where it's all about collaboration and connection. So we have enjoyed a relationship with UT School of Public Health, which really facilitated an opportunity to secure a grant through Blue Cross and Blue Shield. That was a while back. We have been awarded a grant through Department of Agriculture as well, the 3Es grant that works quite well, and the Catch Global Foundation helped us with that a little bit, and then we've had a couple of grants through Texas Parks and Wildlife, and most recently the SHAC was involved with a school district bond that we got $1.8 million to do new playgrounds with. So I hear you on money being a problem, and I think that what it takes is you have to be a bulldog and never stop asking for money ever. And it's one of those things that there's no easy answer on it, but money brings more money. And so as you demonstrate that you are able to, as people start to celebrate, hey, look at the cool things that we can do, then there's more opportunity for that. So it's not the easy answer. I hear you, but don't ever be intimidated by it.
I would also, thank you, Pete, and I would also echo not to forego looking around in your community for those community partners and resources. And I think Joycelyn would agree. You have tremendous support in resources to program, whether it's nutrition programming, school gardens, etc. There are a number of organizations. Obviously, AgriLife Extension is one, but there are multiple other organizations across the state that are local in your area, and it's really about what are your goals and lining up your best community partners.
Awesome. So we have a few more questions that we will definitely answer in our email follow-up. Just give us a couple of days to put that together. We will be posting this recording to YouTube. I want to really thank my wonderful experts, Joycelyn and Alice and Mario and Stephanie and Ray and Pete. You guys are wonderful as usual. They have so much knowledge to share. They don't even know how much they know anymore. So we hope this has been helpful, and we hope that the resources and the follow-up information we share helps as well. And look for some webinars this fall on different topics. We're planning one around vaping for sure. We'll probably do a SHAC 101. We're going to ask you to tell us if you think this is helpful or if you'd rather have webinars or some of both. So watch for our email and please respond to us when you get it, so that we really know how we can best support SHACs, because I think they're going to play such an important role. I also work with the Partnership for Healthy Texas, And one of the things we're looking at is how we can share what SHACs do with the legislators and show them how important they are, so that we get more support and more credibility. So thank you all for joining us. And I hope that we will see you on our webinars in the fall. And thanks, everyone. Have a great day.